sheer number of deaths from the coronavirus is staggering, and there are those on social media spreading the notion that the numbers are inflated. Tonight, Local 12 Chief Investigative Reporter Duane goes after the truth.
Sadly, the coronavirus death toll in our country is stunning, and it would be a lot higher if we weren't taking these extraordinary measures like staying here at home. But in the midst of these tragic figures, some say the numbers are exaggerated because they claim we're counting people who didn't really die from COVID-19. Social media has been filled with claims and questions about the numbers of reported coronavirus cases for months. But the death toll came into clear focus a few weeks ago when Scott Jensen, a physician and state senator in Minnesota, questioned this: guidance for certifying deaths due to coronavirus disease. It was issued on April 3rd by the Centers for Disease Control, or CDC. It instructs doctors how to properly fill out death certificates for COVID-19 cases, even when the patient was not tested to confirm they had coronavirus. The guideline states, in cases where a definite diagnosis of COVID-19 cannot be made but is suspected or likely, it is acceptable to report COVID-19 on a death certificate as probable or presumed. Dr. Jensen called that ridiculous because he said it would allow people to massage and game the numbers. That triggered claims on the internet and social media that the number of dead is being exaggerated. But Forbes, the Wall Street Journal, and New York Times have all reported the lack of testing has caused coronavirus deaths to be underreported. In an April 7th article in the New York Times, a senior scholar at the Johns Hopkins University Center for Health Security said, "We definitely think there are deaths that we have not accounted for." And it was that concern about underreporting COVID-19 deaths that led to the new guidance from the CDC. And while the instructions do allow COVID-19 to be listed as a cause of death without a test, it's not a mandate for guessing. In the guidance paper itself, the cause of death is left to the doctors using their best clinical judgment. So if you think the actual number of deaths from COVID-19 isn't exact, you're right, because sadly there are probably more. But if you think these numbers are exaggerated, you're wrong. I'm Duane Pullman.